Hi friends, so that's day 2 and today we'll discuss about cataracts, some morphologies of different types of cataracts. The question which I gave in the morning was a 44-year-old came to the clinic complaining of blurry vision. The vision was less, it was 636. The doctor observed the finding which is marked in the picture which was given to you. Here was the opacities of the cataract. What history will be least useful in this scenario? So many of you people have missed this least useful. So let us see what is this picture showing. Okay, so this which I am marking, this is a line because of slit lamp on the surface of cornea, like a slit, whose reflection goes onto the iris. Pupil is dilated, so iris is on the periphery, and this is the entire lens area. Okay, so this is the entire lens area. This is the anterior part of the lens, this is the posterior, and you can see the opacities in the posterior part of the lens. So this cataract is a posterior subcapsular cataract. So most of you who have answered this posterior subcapsular cataract, that is okay, but the question was which history will be least useful. For that you want to know what are the causes of posterior subcapsular cataract. I always say remember the causes of PSC, posterior subcapsular, as BSC. B means busulfan drug. Other B, blowers, glass blowers cataract, that is because of radiation exposure. S, steroid, very very important use. From C, you can have drug, chloroquine, not chlorpromazine, chloroquine. Complicated cataracts, for example, uveitis, and uveitis, patient has frequent redness, pain in the eyes, recurrent. And cupoliform cataract, that is one type of senile cataract. History of psychiatric illness, chlorpromazine causes anterior subcapsular cataract, and that was the answer to today's question. Okay, so that is why you made a mistake. Maybe you made a mistake in reading this least useful, or you made a mistake that chlorpromazine causes posterior subcapsular. That is wrong. It causes anterior subcapsular cataract. So let us quickly, I'll show you other morphologies as well. So here can be the morphologies in the lens. The cataract in the center is a nuclear cataract. In the periphery it can be cortical cataract, or it can be posterior subcapsular, or it can be anterior subcapsular, or it can be on the poles, anterior pole, posterior pole. Let us see different shapes. So here you can see this is the lens. Again, this is the light on the slit lamp on the level of cornea. This is the lens. The center has opacity. So this will be nuclear. This is nuclear sclerosis or nuclear cataract. Here you can see the other picture. I'll show you the next picture now. The next picture, there is no opacity in the center. It is a cortical cataract. Okay. And particularly this is a cuneiform. I'll show you just now. Now this was a picture, posterior subcapsular cataract. And here you can see this is anterior subcapsular opacities. Okay. And if you can see this picture quite clearly, this is the cornea, this is the lens, and the posterior part of the pole of the lens is having cataract, that is posterior polar cataract, like an onion shape. Posterior pole is like an onion shape. So this can be the various morphologies in the cataract. Okay, let us see morphologies in the child. Blue dot cataract. In the cataract looks like a dot dot dot. The color is blue. That is the most common morphology in congenital cataract, but it does not cause loss of vision. Zonular cataract is another congenital cataract in which the child will have loss of vision, and it has these. You can see the projections. These projections are riders and spokes like a cycle. In senile cataract, you know the morphology. It can be nuclear sclerosis, nuclear cataract. I showed you that is in the center. Cuneiform, that's the most common morphology of senile cataract in the periphery, like spokes, radial spokes. And which I was telling you, cupoliform. You can see here again. This is the cornea. Iris, okay, this is the lens, opacity in the posterior part, posterior surface. So cupoliform is also example of posterior subcapsular cataract. Alright, what else? What happens in senile cataract? You know, there is lamella separation in the first stage, which becomes intumescent. Intumescent incipient is the second stage. Intumescent means the lens becomes swollen because of hydration. And you can see here, if the lens becomes hydrated, it will push the iris forward, close the angle, leading to secondary angle closure, phacomorphic glaucoma in second stage. Also, there is frequent change of glasses in this stage. Next, there comes immature senile cataract. Then mature senile cataract is a hard and complete, total hard and white cataract. And later on becomes hypermature senile cataract, in which one type is, if this is a nucleus and the cortex dissolves, what happens? The nucleus will drop down like this. This is Morganian type of hypermature. This can also lead to a glaucoma, that is phacolytic glaucoma or lens protein glaucoma. It is a secondary open angle type of glaucoma because it does not pushes the irid, it blocks the trabecular meshwork. It is a secondary angle open glaucoma, phacolytic. One problem which you always face is iris shadow. So iris shadow is seen in immature senile cataract. Yes, but not in mature senile cataract. Okay, you don't have to remember everything, but just remember this. Iris shadow is present in immature senile cataract. What is immature and mature? Immature means, you can see in this picture, this is immature. All the entire lens is not having cataract. Okay, so some part of the lens is still left. So this part is left. So the iris shadow will be formed because there is some part of the lens is still left. Here the entire lens is having opaque. So if the entire lens is having opaque, there is no area on which the shadow can be seen. So mature senile cataract will not have an iris shadow, while immature there is a space between the anterior lens capsule and the cataract. So a shadow will be formed there. Okay, so that is the iris shadow, difference between immature and mature. Alright, next. This is again a total cataract, like a pearly white, that is a rubella cataract. This is a child having urine reducing substance, nausea, vomiting after having galactosemia, oil droplet cataract. This is Christmas tree cataract, myotonic dystrophy. This is diabetes mellitus, snowflake, like a snowflake cataract, diabetes mellitus. Okay, this one is like a sunflower cataract. Sunflower cataract, you always have a problem. It can be seen in Wilson's disease, of course, that is one of the important causes, but it can be seen in chalcosis. Chalcosis is intraocular copper, and that is, if copper is going inside, that is of course due to penetrating trauma. So penetrating trauma, chalcosis and Wilson's can cause sunflower cataract, while this is a rosette type of cataract seen in blunt trauma. This is again example of anterior subcapsular, that is a shield cataract. Okay, so anterior subcapsular cataract, which I showed you, can be seen in A, atopic dermatitis, that is shield cataract, that is atopic dermatitis. It can be seen in AU, gold. It can be seen in C, chlorpromazine. Okay, that is anterior subcapsular etiologies. Alright, I think that will be all the cataracts morphologies for you. Thanks a lot. Best of luck everyone, and stay safe, stay at home. We'll see you tomorrow.